Starting with today's lecture. So classification of disease, it is explained from aphorism number 72 to 81. That is classification of diseases. And this the summary of aphorisms is that is in aphorism number 72 they explain about the general survey of disease. Then aphorism number 73 types of acute diseases. Then aphorism number 74, it is artificial chronic diseases. Then 75, artificial chronic diseases are most incurable. Then 76, it is vital force still powerful that injury can repair. Then 77, false chronic diseases. 78, true chronic diseases. Then 79, knowledge of syphilis psychosis. 80, fundamental cause SORA, and 81, that is development of SORA. So in this the classification of diseases, this is classified mainly into three types, that is indisposition, surgical diseases and dynamic diseases. So in this actually what is mean by disease? So disease is uncomfortable state of mind and body. Disease can be defined as deviation from a state of complete physical, mental and social well-being. That we call it as a disease. Then in classification, first is indisposition. So we studied about indisposition in detail in aphorism number 150. But in this classification of disease, it having a short explanation as indisposition means it is a slight alteration in a state of health manifested by one or more travel symptoms with a slight alteration in diet and regimen will usually suffice to dispel such illness, and it is explained in aphorism number 150 in detail. So there are no need of any medicines in these cases, only slight alteration in diet and regimen will cure it. So you have to give the examples, that is night watching causes headache, overeating causes loose motion, etc. Then the second type is of surgical diseases. Now what is surgical diseases? Are those diseases in which there is a derangement in dynamic force due to dynamic cause or a dynamic cause, where medicinal aid is helpless, but when such diseases can be well treated with the help of surgery by giving preoperative, postoperative or dynamic homeopathic medicines, they are called as a surgical diseases. And in this, in case of injuries occurring to the body from without the treatment of such diseases is related to surgery, but this is right only in so far as the affected parts requires mechanical aid, where by the external obstacles to the cure which can only be expected to take place by agency of the vital force. That is, in these surgical diseases, they require a medical aid or a mechanical aid. That is, we take example as a fracture of bone. In this, along with mechanical aid, you can try the homeopathic treatment also, or you can give the homeopathic treatment as a pre-operative or a post-operative treatment. But in this the surgery is necessary or surgical aid is must. So this type of disease we call it as a surgical diseases, and these are caused mainly due to the external causes. In this there is no internal cause present, so this we call it as a surgical diseases. Now the third main type of disease, that is dynamic disease. And dynamic diseases are caused due to derangement in dynamic force due to dynamic cause. So there is presence of dynamic cause. In this they are again of two types, that is acute chronic diseases and chronic acute dynamic diseases and chronic dynamic diseases. So in this the acute diseases are those diseases in which onset is sudden, duration of suffering is short, signs and symptoms are violent, in which there is a presence of prodromal period, progressive period and decline period. At the last there is a complete recovery and death of a person. So in this acute diseases having the prodromal period, progressive period, and decline period. So, what is the prodromal period? That is from attacking of foreign influence upon a man to the feeling of first abnormal sensation is called a prodromal period. Then the progressive period, that is from feeling of first abnormal sensation to the reaching of its highest peak is called as a progressive period, and decline period means from the highest peak symptoms and signs are decline and coming towards normal is called as a decline period. So acute diseases are caused by exciting causes, that is the acute miasms, and it having a types, that is individual acute diseases, sporadic acute diseases, and epidemic acute diseases. So individual acute diseases, these are the diseases in which individual person gets affected due to acute explosion of latent sora. That is, in this only an individual gets affected due to some acute explosion of latent sora, and it may be caused due to excess in food, insufficient supply of food, severe physical impressions, chill, overeating, strain, mental emotion, etc. In this example, you take as a acute cold, coryza, acute diarrhea, malaria, sepsis, etc. Then the second type is of sporadic acute diseases. So sporadic acute diseases means these are acute diseases which attack several persons at a time here and there. That is, in this the several persons gets affected here and there at different places in which cause is same. The persons affected at different places, but the cause is same. Signs and symptoms to be the some extent are similar or in different patients, and in this you take example as tetanus or rabies. Then the third one, that is epidemic acute diseases. In epidemic acute diseases, these are acute diseases in which many people are affected at a time due to some climatic conditions in one locality. Here with cause of disease is same signs and symptoms and also the same. These are the diseases where they remain or present in thickly populated places becomes contagious. So example you take that, now a routine example, that is of cholera, plague, and nowadays that is corona. These all are the epidemic acute diseases. So these are the types of acute diseases, that is individual acute disease, sporadic acute disease, and epidemic acute disease. Now the second is chronic diseases. So what is the chronic diseases? The chronic diseases are those diseases in which there is derangement in dynamic force due to dynamic cause, in which onset of disease is imperceptible, slow and gradual, and intensity of signs and symptoms is less, in which the presence of prodromal period and progressive period, decline period is absent. So they end with death of a person unless and until dynamic aid of homeopathic medicine is not given. And in this you may take example as diabetes, hypertension, renal diseases, cirrhosis of liver, asthma, COPD, etc. Then the types of chronic diseases. The types of chronic diseases, that having a artificial chronic disease, false chronic disease, and true chronic disease. False chronic disease also we call it as a pseudo chronic diseases. So these are the types of chronic diseases. And here you make the mistakes, that is theory of chronic disease is different and types of chronic disease are different. When you have to ask the types of chronic disease, you have to mention these three types of chronic diseases. These are the types of chronic diseases, and theory of chronic disease is different. That is one of the cardinal principle of homeopathy, that is theory of chronic disease. And you have to note down the cause behind the theory of chronic disease in theory of chronic diseases. And when you have to ask the types of chronic diseases, you have to mention these three types of chronic diseases. In last exam, most of you make the mistake in writing the theory of chronic diseases, that you have to ask the theory of chronic diseases and you most of the you write the types of chronic diseases. These three types of chronic diseases, but these are not the theory. This is not the theory of chronic disease. These are the types of chronic diseases. That is artificial chronic disease, false chronic disease, and true chronic disease. I again repeat it. These are the types of chronic diseases and not the theory of chronic diseases. So, first type of chronic disease is artificial chronic disease. So, artificial chronic diseases, also called as a drug diseases, they are produced by prolonged use of large and crude doses of unhomeopathic medicines, which are given in large and increasing doses, like mercurial ointment, nitrate of silver, iodine and its ointment, opium, sulfur, sulfuric acid, purgatives, etc. That is, when we take any drug substances in large doses, that produces a disease condition, that we call it as a artificial chronic diseases. That is, they are produced by prolonged use of a large and crude doses of unhomeopathic medicines. So, due to prolonged use of such crude drug substances, causes great derangement in the dynamic force, that patient lands into tissue changes or structural changes, and they are not true chronic diseases, as artificial chronic disease is different from the true chronic diseases in the sense as the cause behind this artificial chronic disease is the use of a, that is use of a crude drug substances in large amount, and that patient lands into tissue changes and structural changes. They are not true chronic diseases, although called as a chronic disease because their manifestation is as good as true chronic diseases, as their picture is like a chronic diseases, hence we classified them into a chronic disease. Then pathological changes which takes place in such diseases are such grave or worse that the patient lands into irreversible pathological changes. Ultimately, patient becomes victim of incurable diseases. So, at the last, these diseases becomes the incurable diseases. So in this we take example as abuse of steroids causes failure of kidney. That is, when you take abuse of steroids as a painkiller, that causes the failure of kidney. Then overuse of silver nitrate cream causes CA of skin. That is, when you use the silver nitrate as an ointment or as a cream, it causes the cancer of skin. So these are the examples of artificial chronic diseases. Then the second type of chronic disease is of false chronic diseases. So what is false chronic diseases? The false chronic diseases are chronic diseases in which there is a derangement in dynamic force which is as good as true chronic diseases. That is way such diseases are called as a chronic diseases, but causes in such diseases is maintaining cause or avoidable noxious influences, like in taking of alcohol, prolonged use of unnecessary, that is abstinence from things that are necessary for the support of life, then living in unhealthy localities, living in marshy places, lack of exercise and open air, overexertion of mind and body, then constant state of worry and anxiety. So these are the different causes, maintaining causes that leads to a patient that type of chronic disease, and that we call it as a false chronic disease. The picture of disease is same like a chronic disease, hence we take in a classification of chronic disease. And in this, in order to manage such diseases in true sense, there is no need of dynamic medicine, can only be treated by removing the maintaining cause, and such diseases can be cured by removing the maintaining cause which is behind the disease condition. So in this, the cirrhosis of liver due to alcohol consumption, these are the different examples of false chronic disease, that is cirrhosis of liver due to alcohol consumption, then asthma patient working in silicosis company, then tuberculosis patient living in marshy places, then obese patient lacking in exercise. These are the examples of false chronic diseases. Now the third important type of chronic disease, that is true chronic diseases. In this, what is true chronic diseases are those diseases in which there is a chronic derangement in dynamic force due to chronic dynamic cause, ends with death of a patient unless and until not treated by taking aid of chronic deep acting dynamic remedies, and they are called as a true chronic diseases. Now in this, the vital force is deranged, and this vital force is deranged due to some dynamic cause present in a body, and that we call it as a dynamic or a true chronic diseases. So in this, they again divided into a single true chronic diseases or a complex true chronic diseases. In this, single chronic diseases are psoriasis, psychosis and syphilis, and complex true chronic diseases are psoriasis, pseudosyphilitic, psychosyphilitic, pseudo-psychosyphilitic. So this is the classification of diseases in short what we studied in second year. And after this, the true chronic diseases again having the fully developed symptom and few symptoms. So fully developed symptoms, they are divided into psoriasis and syphilis, or the complex true chronic diseases. But the few chronic diseases, that is symptom diseases having few symptoms, are again the one-sided diseases and the local diseases, and that we covered in a previous class. But in today's lecture we are giving main focus to the theory of chronic diseases, that is Hahnemann's theory of chronic diseases. And what is this theory of chronic diseases? So up till now, this is a revision part regarding the classification of diseases, and in the last aphorisms of this classification. Hello, confirm your mute. Trupti, Trupti. So now we are discussing the Hahnemann's theory of chronic diseases. So what is the theory behind this chronic diseases? So all of you know the seven cardinal principles of homeopathy. So which are they? Seven cardinal principles of homeopathy. Anyone? Seven cardinal principles of homeopathy. So in this seven cardinal principles, what the theory of chronic disease explained by Dr. Hahnemann. This we have to explain in detail about the Hahnemann's theory of chronic diseases. And when you have to ask the theory of chronic diseases, you have to write this theory of chronic diseases and not the classification of chronic diseases. First, you remember this part, that is when you have to ask the theory of chronic diseases, you have to explain the part which now I am going to take, the theory of chronic diseases. So in this, the Hahnemann's theory of chronic diseases, he wrote the books on this theory of chronic diseases, and how he comes to the conclusion that what is the cause of these chronic diseases. So in this, Hahnemann, after discovering and practicing homeopathic method of treatment for about 30 years, that is after the discovering and practicing homeopathic method of treatment for about 30 years, that is from 1719 to 1820, that is AD. 1790 to 1820 AD found that homeopathy failed to bring a real cure in some diseases, in the sense that though the diseases appeared to subside for a time under properly selected homeopathic drugs, they always had a tendency to relapse at some future time. So, what Dr. Hahnemann found that is after the practicing or the after the discovery of homeopathy for about 30 years, he found that the homeopathy failed to bring a real cure in some diseases. So, there are some diseases in homeopathy in which homeopathy cannot bring a real cure or a permanent cure, and cure in some diseases in the sense that though the diseases appear to subside for a time, as these diseases appear to subside for some time, that is they having the relief for some time, but after some time they again reappeared, that is under properly selected homeopathic drugs they always had a tendency to relapse at some future time, means for some time they get relapse, that is subside, but after some time they again relapsing, means again coming, that is appearance of these symptoms are again and again future time, that is the same vital force which is stimulated effectively overcome the infection in acute diseases by homeopathic simillimum remedy fall to the roused effectively against the infection in chronic diseases, that is the diseases relapse at some future times, means after some time these diseases again relapsing. So that is the same vital force which is present in acute condition also, that is the same vital force which is stimulated effectively overcome the infection in acute diseases, means when we give the medicines to the acute diseases, the same type of medicine to the same type of patients, when we give medicines to the acute diseases can cure permanently, they cannot reappear again and again, but there are some diseases, chronic type of diseases which can reappear again and again. So by homeopathic simillimum remedy fall to roused effectively against the infection in chronic diseases. So what happen in chronic diseases, with the aid of remedies which best cover their present symptoms, that is we select the medicine properly, we select the proper simillimum and give to the patient, then what is the reason that the chronic diseases are reappeared again and again. This is the main theme behind the invention of theory of chronic disease, that is Dr. Hahnemann found that after the discovery and practicing of 30 years of homeopathy, he found that there are some diseases, these are the chronic diseases which are reappeared again and again. The same medicine in same patient can cure the acute diseases very well, but there is something behind in these chronic diseases which causes these diseases reappear again and again. So with regard to treatment of chronic diseases, Hahnemann stated that it starts was pleasing, the continuation less favorable, and the outcome hopeless. So what Dr. Hahnemann told about the chronic diseases, as when we select the medicine for a chronic diseases, he found that the its start was pleasing, that is when we give the medicine for a chronic disease, the patient feeling well, that is start was pleasing, then the continuation less favorable, that is when we continue the medicine, the continuation is less favorable, not so favorable in a chronic conditions, and the outcome is hopeless. But at the last, the what is the outcome of the patient, that is hopeless, that is the patient is not cured permanently, the for some time he is feeling better, but after some time, after a fixed period of time, the patient reappeared with a same signs and symptoms. Then what is the cause behind this, he has to find it, and the apparent failure of readily curing certain diseases may be due to one or more of the following reasons. So he continuously thinking about that thing, that is why it is happen about the chronic diseases, and for this reason he asked questions to himself about this, and he put forth the questions that the following may be the reasons for the that chronic diseases are not cured permanently. So in this he explained the five reasons, that is certain diseases may be due to one or more of the following reasons. So in this he gave the five reasons behind the reappearance of a symptoms in a chronic diseases. So in this the first cause he reason he put forth, that is the law of similars might not be the law of universal application. That is what is the first reason he think, and he has to overcome from these reasons. He give again the explanation about these or arguments about these reasons also. That is the first reason is the law of similars might not be the law of universal application. Then the second reason is the number of drugs hetero discovered for use as a homeopathic remedies were too few to cover all the varieties of diseased condition that afflict human beings. So first reason is the law of similars might not be the universal application or not a universal law. Then second reason he think of, that is the number of drugs, that is up till now the number of drugs which we proved in a homeopathy that are less or that are incapable of curing that diseases, that these number of homeopathic remedies were too few to cover the all varieties of disease condition. That is these are the few medicines and to cover all the varieties of disease condition that afflict human beings. So this may be the second reason. Then third reason he think of, that is there might be some defect in the application of the law of similars. First is the law of similar is not be the universal law, universal application, law of universal application, and the third reason is that there might be some defect in the application of the law of similars, means while we select the medicine there must be some defect in that application of that law of similars. Then the fourth reason is there might be some omission in ascertaining the totality of symptoms which constitute disease for homeopathic method of treatment. And fourth reason is that when the physician took out a totality of symptoms that may form some uh, queries or that may constitute the disease for homeopathic method of treatment, or there may be some omission in ascertaining the totality, that totality which physician form is not a sufficient totality that can find out the exact medicine to the patient. So that may be the reason behind the these chronic diseases. And the fifth reason he put forth is there might be some obstacles overlooked, the persistence and non-eradication of which prevented lasting recovery. And fifth reason is that there must be some obstacles that may be overlooked, the persistence and the non-eradication of which prevented lasting recovery. So there may be some obstacles in the recovery. There is something which we cannot found behind that. So this is the different reason behind the theory of chronic diseases. Yes, can I audible?
Yes, ma'am.
Okay. So we are discussing the different reason behind the theory of chronic diseases. That Hahnemann put for these reasons and then find out what is the main reason behind the theory of chronic diseases, or why the chronic diseases are reappear again and again. So he put forth these five reasons. In this first reason is the law of similars might not be the law of universal application. Second, there are few medicines proved in homeopathy that cannot cover the number of diseases of human beings. Then third is there may be some defect in the application of law of similars. Then fourth is there may be some defect in the selection of totality of symptoms. And the fifth reason, there may be some obstacles present that causes the chronic diseases not cure permanently. So these are the five reasons. Then Hahnemann took up the discussion and made the arguments in the following way. So one by one he uh, put forth the reason and find the exact reason behind the theory of chronic diseases. So discussion about the first reason is that the first reason is the law of similars might not be the law of universal application. And for this he think about he discussed about the reason, that is the law of similars might not be the law of universal application. And for first reason he dismissed the first point on the ground that the validity of the law of similars is based on observation and experiment and supported by inductive and deductive processes, and law was observed to be followed by nature herself to bring about a cure of natural diseases. So about the first reason, he put forth the discussion that he dismissed the first point on the ground that the validity of the law of similars is based on observation and experiment, as this law is based on a number of observations and experiment, and it is not only a theoretical law, it is based on experiments what he has done in past. So this is based on observation and experiment and supported by the inductive and the deductive processes, and law was observed to be followed by the nature herself. That is, in nature you have a number of example, or nature herself follow this law, that is law of similars. So this may not be the reason behind the chronic diseases or a reappearance of chronic diseases. So the first reason is omitted or dismissed by the Dr. Hahnemann on the basis that this law is based on the experiment and observation. This is based on inductive and deductive processes, and it is followed by nature herself. So this first point or first reason is omitted or dismissed by Dr. Hahnemann. Then about the second reason, that is, in homeopathy there are few medicines proved which might not be cover all the disease conditions of human beings. So in this he give the discussion as Hahnemann made the second reason. Thus the second reason or excuse never satisfy the founder of homeopathy, as this reason not satisfy the founder of homeopathy, as there are number of homeopathic medicines and they are increasing from year to year, as there is a proving of number of medicines and this number is increasing from year to year. And if these medicines cure the acute diseases permanently, then what is the reason behind chronic diseases to be not cured? So this reason also get omitted by Dr. Hahnemann, that is by the discussion, as there are number of homeopathic medicines that are proved and they are increasing from year to year, and if these medicines cure the acute diseases permanently, then what is the reason behind the chronic diseases? Hence it could not be the reason of reappearance of chronic diseases again and again. So the second cause also gets omitted. Then the third and fourth cause, he give the explanation as same for the third and fourth cause. Hahnemann explained for third and fourth reason as Hahnemann was led to conclude that though certain cases were temporarily benefited by remedies which seem to correspond accurately with the symptoms actually present, means the law of cure was not at fault, but the defect was in ascertaining the totality of symptoms on a wider basis, comprising not only the present syndrome but the past syndrome as well. So in this, the reason, that is the third reason, that is the uh, defect in the application of law of similars. There may be some defect in the application of law of similars, but for this reason he give explanation as when the patient is feeling well for some days, then how the application of law of similar is at defect. When it is at defect, the patient may not feel better for some day also. For this he exclude the third cause as when benefited by remedies which seem to correspond accurately with the symptoms actually present, means the law of cure was not at fault, but the defect was in ascertaining the totality of symptoms. But there may be the defect in ascertaining the totality of symptoms on a wider basis, comprising not only the present syndrome but the past syndrome as well. And while forming the totality of symptoms, it may be the defect in comprising not only the present syndrome but the past syndrome as well, that the physician must know about all the present state of patient or a present syndrome and on the past syndrome also. That is something, there may be something cause or there may be something obstacles that may be present behind the forming the totality. So in this, the fourth point may be omitted, but fourth point may come with a fifth point, that is the totality becomes incomplete due to comprising the present syndrome and the past syndrome. That is, when the physician take the totality, he must know each and everything about the patient and the cause, that something is behind this disease condition. If he cannot recollect that cause, then the totality becomes incomplete, and this may be the reason that the totality of symptom on a wider basis, comprising not only the present syndrome but the past syndrome as well. So the fourth point become the wrong on the basis of the fifth point. So for the fifth point he give the explanation as thus Hahnemann was led to think of the existence of some obstacles which after it has once advanced and developed to a certain degree can never be removed by the strength of any robust constitution or can never be overcome by the most wholesome diet or order of life, nor will they die out of themselves. So the fifth cause is there may be some obstacles in the or obstacles overlooked, the persistence and the non-eradication of which prevented lasting recovery. So for this he put for the fifth reason, that is there is something behind these diseases that we cannot see with our eyes, but we have to find them with a present syndrome totality and the past syndrome totality. So these obstacles, they named after this obstacle as a miasm, as a psoriasis, psychosis and syphilis. So in this fifth point he discussed as thus Hahnemann led to think of existence of some obstacles. There may be some existence of obstacles which after it has once advanced and developed, that is if these obstacles remain for some days, it becomes advanced and developed for a certain degree and can never be removed by the strength of any robust constitution. If the patient is very robust, then it cannot be removed, or even if you overcome by the most wholesome diet or a regimen, nor will they die out of themselves, or your diet regimen cannot remove them, or they uh, will not die themselves, means they cannot removed by themselves also. So there may be some obstacles in that recovery, and these obstacles to cure of many cases was found by Hahnemann after searching investigations and prolonged observations, nor on non-mineral patients to lie very often in a former each eruption, and these eruptions of each suppressed by faulty practice or one which had disappeared from the skin through other means. So this may be the obstacles, that is, these obstacles to cure of many cases was found by Dr. Hahnemann after searching investigations and prolonged observations, that is, after many investigations and prolonged observations on non-mineral patients, he found that there may be some obstacles to that recovery which to lie very often in the former each eruption, and these eruptions of each suppressed by faulty practice or one which had disappeared from the skin through other means when there is some each eruption present in a patient that may be treated with some faulty practice, or that may be suppressed by some ointment or some other things, and these suppressed thing get the, that is the obstacles to that cure, and that becomes developed and become advanced, and that become the cause of these chronic diseases. And up till when we remove that obstacles in the recovery, then and then only the chronic diseases get removed permanently. If we cannot remove these obstacles, then the chronic diseases not recovered permanently, they reappeared again and again. So Hahnemann gave general name to obstacles in the terms of a symptom syndrome. So after this, Dr. Hahnemann first give name to these obstacles as a symptom syndrome. Later on, this obstructive symptom syndrome was named by him as a SORA, and after this, after some time or after some study, he gave this obstructive symptom syndrome as a name of SORA, the internal itch disease with or without its attendant eruption on the skin, as it may be with a eruption or without the eruption or itch on the skin. And in this way he discovered the theory of chronic disease, that is the miasms, that is psoriasis, psychosis and syphilis, and these are the fundamental cause of diseases. And when we have to treat the chronic diseases permanently, you have to find out the cause, that is the obstacles, that is the symptom syndrome, means the miasm behind these chronic diseases. And when you remove these chronic diseases or the cause of these chronic diseases as miasms, as when you treat that miasms with anti-miasmatic treatment, then and then only the chronic disease gets cured permanently. So these are the different reasons that put forth by Dr. Hahnemann to study the reason behind the chronic diseases that reappears again and again. So this is the theory of chronic diseases, and after this point comes, that is the miasms. So all of you understand this is theory of chronic disease. Yes.
Yes, ma'am.
When you have to ask the theory of chronic disease, you have to mention these points, that is what Dr. Hahnemann found, or after the discovery of homeopathy or practicing the homeopathy up to 30 years, he found that the acute diseases are cured permanently, but the chronic diseases reappeared again and again. Then what should be the reason behind it? So for the study he put forth some reason that come in his mind. So he put forth the 5 reasons that may become the cause of these chronic diseases that reappears again and again. And after the study or discussion or the arguments, he find out the 5th cause, that is there may be some obstacles, and that obstacles causes the these chronic diseases to reappear again and again, as these are not removed only by the symptom similarity, or you have to give that anti-miasmatic treatment. When you give that anti-miasmatic treatment, then and then only the chronic diseases get cured. So for this, firstly he give that obstacles name as a symptom syndrome. After this he gave name as a sora, and then the discovery of psychosis and syphilis. So in this way he discovered the theory of chronic diseases, that is the cause of diseases, that is fundamental causes, that is miasm, sora, psychosis and syphilis. So all of you understand about the theory of chronic diseases, or any difficulty regarding any point? Yes, all of you understand?
Yes, ma'am.
ओके. याच्यामध्ये त्यांनी जो फोर्थ पॉईंट सांगितला ना, थर्ड पर्यंत तर त्यांनी ओमिट केले, डायरेक्ट ओमिटच केले, फर्स्ट सेकंड थर्ड पॉईंट. पण फोर्थ पॉईंट त्यांनी डायरेक्ट ओमिट का नाही केला? कारण की त्यांनी काय सांगितलं की ते ऑब्स्टॅकल्स आपण म्हणजे फाइंड आउट नाही करू शकलो. कशामध्ये? टोटॅलिटीमध्ये. जेव्हा आपण टोटॅलिटी काढतो पेशंटची, तेव्हा ते आपण ऑब्स्टॅकल फाइंड आउट नाही करू शकलो. मग त्याच्यासोबत मग हे पण कॉज असू शकतं फोर्थ. का नाही ते कम्प्लीट का नाही झालं आहे? कारण की आपण ते ऑब्स्टॅकल फाइंड आउट नाही केलं आहे, त्याच्यामुळे ती टोटॅलिटी कंप्लीट नाही झाली. मग त्याच्यामुळे त्यांनी फिफ्थ कॉजला आणखी स्टडी केला, आणि त्याच्यामध्ये मग त्यांनी रिअल कॉज काय तो फाइंड आउट केला. मग त्या ऑब्स्टॅकल्सलाच त्यांनी पुढे जाऊन काय नाव दिलं? दॅट इज ऑब्स्ट्रक्टिव्ह सिम्पटम सिंड्रोम. आधी ते नाव दिलं होतं, त्याच्यानंतर मग त्यांनी त्याला सोरा, सायकोसिस, सिफिलिस आणि त्या सगळ्यांना मिळून मग काय नाव दिलं? दॅट इज मायाझम. मग प्रत्येक जे काही ट्रू क्रॉनिक डिसीज आहेत त्यांच्या जो काही फंडामेंटल कॉज आहे तो काय? मायाझम आहे. आणि जोपर्यंत तुम्ही मायाझम ट्रीट करत नाही तोपर्यंत डिसीज क्युअर होणार नाही. सो दिस इज द थेअरी ऑफ क्रॉनिक डिसीजेस. कळाली सगळ्यांना? यशवंत?
येस मॅम.
ओके. याच्यानंतर मायाझम्स घेतले होते का तुमचे, घ्यायचे आणखी? सोरा, सायकोसिस,
लेना है एक बार.
लेना आहे का? आणि हे थेअरी ऑफ क्रॉनिक डिसीजचे नोट्स आहेत, तर मी एक जणाला पाठवते, यशवंतला पाठवते, मग तो तुमच्या ग्रुपवरती पाठवल परत.
ठीक आहे.
ऑफिशियल ग्रुपवर पाठवण्यापेक्षा एक जणाला पाठवते, मग तो सगळ्यांना पाठवल.
मॅम फिलॉसॉफीचं सांगा ना, म्हणजे सेकंड इयरला काय फिलॉसॉफी?
सेकंड इयरला तुमचे जे टॉपिक आहेत ना, तुम्हाला जे कळाले नाही आहेत ते मी तुम्हाला म्हटलं होतं की सांगा मला, सगळे लिस्ट काढून, म्हणजे ते परत घेता येतील आपल्याला असे. मग प्रत्येक टॉपिकमध्ये काय इम्पॉर्टंट आहे ते सांगितलं असतं मी असं.
फिलोसॉफी में क्या पूछते हैं सेकेंड ईयर में?
ज़्यादातर नहीं पूछते फिलोसॉफी का सेकंड में, मगर कुछ क्वेश्चन आए तो